Hi, I'm Dr. Jay Varma, and welcome to Thermometer. On this channel, I check the temperature of health in the United States and around the world and give you expert insights on infectious diseases and public health. I'm pleased today to welcome my friend and colleague, Dr. John Epstein, for our weekly episode called Inside Bird Flu, where we discuss the latest news about the H5N1 epidemic, both here in the United States and around the world. Welcome, John.
Thanks, Jay. How you doing?
Yeah, great to have you here. I know you've been really busy talking about science around the world, so I really appreciate you taking the time because I think our viewers are going to appreciate these weekly updates on this really important epidemic.
It's great to have the opportunity to discuss this stuff, and don't worry, I always have time for you, Jay.
That's good. I'm glad somebody does in my life.
Yeah.
All right, so let's get to it. So this week, what we're going to focus on is there's CDC puts out what's called a risk assessment. And this is something that public health agencies around the world ideally do routinely, which is basically what is their latest assessment of what this epidemic is doing and what the potential dangers are to human health. So since CDC's previous update, there have been no new human H5N1 cases that were identified. And as of March 18th, 2025, that brings here in the United States the total to be 70 confirmed human cases that have occurred in 13 states since 2024. So this is going back to the beginning of last year. There have been an additional 7 cases that met a probable case definition, but they didn't have testing to actually confirm that they're sick. So there's an estimate that there's 70 confirmed cases, 7 probable cases. And as we've talked about in our previous episode, there's a very high likelihood that there are many other cases that are potentially missed, but we don't know the exact number of that. And CDC also includes in this a conclusion that so far there has been no documented evidence of humans spreading it to other humans. Now, that's the big conclusions that CDC is drawing. Nothing brand new really to report from there. But CDC did report on 3 important studies that have been conducted, and the results are now available. And that's what I'm here to discuss with John about, these important studies that CDC talks about in this risk assessment. So the first of these studies is an investigation into a child in San Francisco who was diagnosed with H5N1. So according to the research report, CDC completed what's called serology testing on blood specimens from the close contact of this child. So this child had a mild illness that was diagnosed as H5N1, and they did blood tests on all of the people who are considered to be close contacts of this child. The testing that was done was looking for antibodies to H5N1. And when they look for antibodies, what they're trying to do is basically trying to test and see whether or not these people who are around and related to the child might have had H5N1 illness as well, but maybe it just wasn't diagnosed or reported. So what they found is when they tested the blood of the child, of course, that child did have antibodies. They were the one who was sick with H5N1, but none of the close contacts of this case in San Francisco had any antibodies. The conclusion they drew from this is that there were no close contacts infected and therefore no documentation of a human spreading H5N1 to another human. So now I want to bring in John to help give the viewers out there a little bit of information about what type of study this was, why we do studies like this. So first of all, John, what is this term serology testing? And why do we do studies like this either on humans or on animals with infectious diseases?
Thanks, Jay. There's basically 2 ways we can pick up disease or evidence of infection, whether it's people or animals. The first is trying to detect the pathogen itself, whether it's virus or bacteria. And oftentimes we use tests such as culture, where you might take a throat swab and try to grow up a bacteria, and that's proof that it's the cause of the illness you're seeing. Another one is a molecular test where you take a swab and you use something called PCR, where you try to detect the genetic material of the bacteria or virus. And a positive test there would also indicate that that bacteria or that virus is present in the sample and likely the cause of the illness you're seeing. But the trouble with that is many times people might get infected, but the amount of virus is too low to be detected by a test like this. Even though it's incredibly sensitive, maybe the body has already cleared it, but people are still suffering from the effects of the infection, so they're still sick. That's where serology can be really helpful. When you get exposed or infected with bacteria or a virus or any pathogen, your immune system kicks into action and creates antibodies, and that helps fight off the infection itself. And those antibodies might stay in your blood a lot longer. They typically stay in your blood a lot longer than the virus does or the bacteria does. And they can be detected by a test even when there's no trace of the virus itself left. And so in this case, with bird flu, testing for antibodies helps us demonstrate that a person had been infected at some point, and how recently that infection was is one of the challenges with serology. It might have been within a week or a couple of weeks, depends on the test and how quickly the body develops antibodies. But nonetheless, it can be a better screening tool and is often used as a diagnostic tool because it's easier to detect those antibodies than it might be to detect the virus itself.
Yeah, so I think, you hit on one of kind of the key points here as well, which is that, we know that for any type of infectious diseases, it is possible to be infected with it and to not actually show any symptoms at all. But your past can show up in your blood tests, right? And so these blood tests are a way for us to get an understanding about kind of what I was kind of hinting at, or actually saying outright in the opening, which is that there are no doubt people who've been infected with H5N1 who haven't been diagnosed. And this is kind of like one way to pick that up. So John, you mentioned that there is, are limitations, of course, that, one of the problems with these is you can't really tell for sure whether they were infected a few days ago or a few weeks ago. Are there any other, limitations we need to be worried about with these tests?
Yeah, sometimes the specificity, what we call the specificity, is whether the serology test you're using is actually detecting what you're looking for or detecting something similar, but not exactly the same. In other words, the way that our immune system works when we make antibodies is they protect us not only against the thing infecting us, but those antibodies can be effective against things that are similar or related. And so sometimes you pick up antibodies, maybe from a past infection with a different influenza virus, and it might look like you've been infected by H5N1. Now, in this case, the serology test is specific to H5, and so it's pretty specific to H5N1 as opposed to, say, seasonal flu. But it's not always the case, and that's one of the challenges with serology is this idea of cross-reactivity, where a test could become positive by detecting something similar, but not exactly what you're looking for.
Yeah, and so the good news basically from this study is that at least for this case of bird flu, first of all, the child had a mild illness and recovered, and second of all, it looks as if everybody that this child was in close contact with, did okay. Now there's two pieces of bad news that I'll talk about. Or the second one, I'll pass over to you, John. The first piece of bad news is we still don't know why this kid got infected, or at least publicly it hasn't been reported. Supposedly this child had no contact with any known sick animals. So this is also worrisome because how did this child get bird flu if they weren't actually in contact with any sick adults or any sick people or any sick animals? And the second is this isn't the only case of bird flu that's occurred in a child this week. So John, there's been a case in Southeast Asia, a place that you've worked out as well too. And why don't you describe for the viewers a little bit about that?
Yeah, it's unfortunate, but important to remember that the US isn't the only place that bird flu is circulating. There are H5N1 outbreaks occurring in other parts of the world. It's fairly prevalent in poultry flocks in much of South and Southeast Asia. And in this case, in Cambodia, there's been an outbreak. And unfortunately, a 3-year-old boy was infected this week and died from his infection. So this is something that doesn't infect people often, but when it does, it can be fatal. And that's always very tragic.
Yes, no, absolutely, and that is the reason why we're covering this topic so intensely here on Thermometer. So let's go into the next topic. There were 2 more studies that CDC discusses in this latest risk assessment, and both of them are trying to answer a similar question. And it actually gets to the point, John, that you just raised before, which is that when the body reacts to a previous infection, whether it's a previous strain of influenza or something else, these antibodies that it produces are what we call cross-reactive. They may not just protect you against that one infection that you had, but maybe against other types of infection. So the second 2 studies that CDC reports on in this risk assessment are studies that were done looking at a previous infection with H1N1 influenza. And for people who remember, this was the strain of influenza that swept through the world in 2009. And what in this study, these were actually studies that were done, it turns out, not in humans, but they were done in ferrets. So before we sort of jump into the details about this study, why are they studying ferrets?
Well, when we look at disease in laboratory situations, we need to use an animal model to better understand how the disease works in people. In this case with flu, ferrets are the most closely, the most accurate model, let's say, that resemble the respiratory infection that people get with influenza infection. So ferrets have become the optimal or ideal animal model to study influenza infections.
Yeah. And so that's, again, for the all time I've been in public health, it's been one of those interesting things where, some of the best studies we have looking at how the flu is transmitted and also looking at therapies is to study this animal model. So John, in this study, they were looking specifically at whether or not a prior infection with H1N1 might provide some protection against you getting infected with this new strain, bird flu, H5N1 strain. What did they find? And do those findings reassure you?
Oh, it's so interesting. So we know that ferrets are susceptible to H5N1. And as we mentioned, they're used as a laboratory model to understand infection. Well, when they had ferrets that had previously been exposed with H1N1, which was as you said, the 2009 pandemic strain, and then they were exposed to H5N1 later, their body already had some underlying immunity or resistance to the H5N1 infection. And so there was less viral replication. The disease that they experienced was less severe. And so it did suggest that previous infection with H1N1 might be protective to some degree against H5N1 infection.
Yeah. And so again, I think this is important, useful information. I think one of the caveats I think they have to this study is that, getting infected by the virus itself is not always identical to getting infected with the vaccine itself. So I think there's some uncertainty still about whether or not if you never had H1N1 infection and you only got vaccinated, whether you have the same level of protection. My guess is that there are very few people around right now who have never been infected with H1N1, except for maybe some very young children. But that's, I think, one of the important caveats here as well.
Well, and we should also mention, I think, we have to mention that it is still really important to get your seasonal flu vaccine, okay, because that will be protective for whatever flu strain is circulating that season, okay, during the winter. So continue to get vaccinated. And this is just some additional possibly good news for people who might have been infected with H1N1 during the 2009 outbreak or subsequent years.
Yeah, and I think that's actually a great place for us to close this discussion, this Inside Bird Flu update for this week. Vaccination. We know how critically important this is. Influenza vaccine is, there was a great CDC campaign, unfortunately, that just got shut down actually by this administration, where the metaphor was they were going to show you a picture of a lion and to show you a picture of a little cat. And the idea was that influenza vaccine helps convert an infection from wild to mild. And then we know the influenza vaccine, it provides a little bit of protection, but not very much against getting infected, but it really does protect you against getting these severe illnesses. So it's never, a bad idea to get your seasonal influenza vaccine. I get mine every year, and let's make sure all of you do too as well. Anything else you wanted to add for this week, John?
No, I think, we'll continue monitoring the situation with H5N1 in America. I think it's certainly something we have to pay close attention to as we start to better understand how it's circulating amongst cattle, amongst other mammals, and especially among people.
Great. Thank you, everybody, for joining this week's episode of The Thermometer for our update on Inside Bird Flu. Make sure you hit like, make sure you subscribe to this channel for more updates about infectious diseases and public health, both here in the United States and around the world.